So in infant preschool services, when we're trying to formulate a diagnosis and try and understand what the primary area of concern of the family is, and then trying to fix a label to it, we're basically organizing our thoughts in the following way. We're trying to follow the multi-axial approach of the DC-03R and the DSM-4 and have a sense of both those approaches, but also have a sensible approach to diagnosis that can then guide intervention. So we try and capture what we call regulation difficulties. So that would include presenting concerns about sleep, toileting, and feeding as primary areas. Older preschoolers, so 3 to 5-year-olds, also present with concerns regarding toileting, and some of these concerns can be behavioral, relational, they may be anxiety-based, and then of course many times these children also have a physical cause for the toileting difficulties. We need to account for medical diagnoses and developmental diagnoses, which include language diagnoses, fine and gross motor concerns, and sensory processing modulation difficulties. And then we move to more mental health areas of concern, which would include potential ADHD, so children that have problems with impulsivity, inattention, and hyperactivity, children with significant anxiety symptoms, including generalized anxiety, separation anxiety, obsessive-compulsive difficulties, and phobias, including social phobia. And then we also are exploring more pervasive difficulties, such as the possibility of autism spectrum disorder. We're also looking at difficulties of behavior, which specifically include difficulties with aggression and oppositional defiant behavior. We see many children on our team who have suffered trauma, and this trauma can be from medical interventions due to severity of physical illnesses the child has experienced. Some children present to us with trauma, for example, a car accident or an accident where they've suffered a burn or another physical injury. We've also seen children that have suffered maltreatment, including neglect, sexual and physical and emotional abuse. And then the last area of concern that is basically underlying many of the previous difficulties I've described are parent-child relational difficulties and concerns about the quality of attachment. So we definitely try and ascertain the quality of the relationship, strengths and challenges, and then address those accordingly in our treatment plan.